Hi, my name is Dr. Michele Grodberg. A lot of my patients ask me how to treat their brown spots, and it's a good question because actually sun damage and brown spots are something that can really make you look much older than you are. So we have a lot of different things in my practice that we use to treat this problem. The first line of defense is obviously sunscreen, which is important for everybody to use, both to prevent and also to help lighten ones that you have already. To add to that, topical products such as hydroquinone, which is a bleaching agent, can be very helpful. And there's also a lot of other lightening and brightening products that can be used topically that actually really do work. Next line of defense, we probably try to do some chemical peels, some light chemical peels, heavier chemical peels, and then even get into the devices such as the intense pulse light, which has very little downtime but does a really good job at lightening brown spots. For those who are not happy with those results, or maybe somebody who even starts out with much more sun damage and a lot more brown spots, we go to something like the Fraxel non-ablative laser procedure, which will have a couple of days of downtime but has some really dramatic results. I also have other lasers that sometimes I'll use to treat individual brown spots. So if you have one brown spot on your face that's bothering you, you wouldn't need to have a whole procedure on your face just to get rid of that one. Anyway, we have a lot of different ways to approach this problem, and I meet with my patients and figure out what is the best approach for each individual and what fits their timing and their budget and their lifestyle. And then we make a decision and go forward, and we really get some great results.